My story begins 75 years ago, so I don't hide my age now. It's no secret anymore. So, okay. I came in this wonderful world 75 years ago, and first to see light in Manila, Philippines. Okay. I came out with an inborn illness, manifesting as I'm getting old. And I was baptized as Erlinda, as you know me now, and we are 4 siblings. My eldest brother in Manila, 2 years ago, suffered a stroke, did not survive. My youngest brother in San Francisco, 4 years ago, suffered a stroke, did not survive. That was the time when I was facilitating at Fairview Flemington with Louis. Okay. My mother suffered stroke in her 70s, and she was able to survive, but in a wheelchair, until she passed away in her 80s. I got widowed at the age of 38. My husband passed away when he was only 39 years old due to brain cancer. And I have 3 wonderful daughters, okay? My eldest has a bad asthma. The middle daughter, she went under the knife at an early age and was diagnosed with papillary thyroid cancer. My youngest one went under the knife due to hysterectomy. I came to Canada when 30 years ago. I went under the knife 5 times and 3 major surgeries. I was diagnosed with papillary thyroid cancer. I have osteoporosis, progressive arthritis, tinnitus, and all the things I don't know. I had the slip disc, and I have progressive arthritis right now, and I have vertigo. Why I am telling you all the stories of my family, the history and the illnesses, is the very reason why I'm standing here before you, and I am with the Toronto Central Self-Management Program. Why I'm so passionate in delivering and facilitating, advocating and supporting the self-management program. Why? Because I believe that alone with the advance in knowledge and technology, that has improved the general health of mankind in recent decades, is the remarkable growth in interest and understanding on the part of the man in the street as to what he can do to maintain and improve his own health. I was one of those in the man in the street, okay? Certainly, the health has always been a basic concern, especially about the history of my family. It is one of the first things we ask a friend, how is his health? But perhaps people were likely to leave the technical aspect of health to their doctors and trust in luck. With people now most people realize there is much that they can do to enhance our own health. Toronto Central Management Program helps fill this need and to encourage this trend. The workshops brings regarding the healthy life with chronic condition is of great success. I am a living testimony and a living witness that in spite of my illness, people see me in walker and in canes, okay? They were encouraged. And as facilitator, we got a number of feedbacks of how different, on how different topics they were able to really help about how they can manage their health and be a good manager. I am a volunteer in the community, a community stakeholder, and also I belong to a Christian faith. And I do social, I belong to the pastoral care. And in my social visit and spiritual visit, I always bring with me, on a spiritual visit the Bible, but with me, I always bring the book, this book. The book is really very helpful to them, The book, it says here, the Living Healthy Life with Chronic Condition, and the Chronic Diabetes and the Chronic Disease Self-Management Program is a leading practice program. It is really a great success per Health Council of Canada. It was really a very good book. Okay. And what more can I say to you? Okay. And I would say that in doing the facility, as a peer leader and in doing facility, what are the values most likely that I have done that I have gathered in this work is the empowerment, as what you have said. We have empowered especially the seniors like me, okay? Whenever we do facility, I said, sometimes I'm being overwhelmed. Just when the participants introduce themselves, I almost get scared and sometimes having stomach butterfly, because some of the participants are of medical profession. They have medical backgrounds, and sometimes they said, my self-confidence is being affected. But when we are trained to do that, we'll have to stick to the book and stick to the manual. Okay, but then participants, at the end of the 6 weeks, what is very encouraging for us and is the appreciation that they have given us. A thank you note that is all that matters to us. Some of the thank you notes, it says like this: thank you for your workshops and what you have done in the community. It makes a difference in our life. And finally, I would like to, you people deserves a big thank you, right? And also the funders, the one who's hosting this, deserve a big thank you from us. Okay? Deserve a big thank you from